Hi everyone, my name is Elias. Today I'm going to do a presentation on pressure area care. Pressure ulcers or pressure sores are a common problem which can severely affect the quality of life for individuals. However, with good care, most can be avoided by removing the causes of pressure damage. The skin, which is considered as the largest and heaviest organ of your body, as you all know, is made up of three layers: the epidermis, dermis, and hypodermis. It has several different functions such as regulating body temperature, providing sensations, excreting waste products, production of vitamin D, and so on. Pressure ulcers, often called bed sores, is a condition affecting the skin of an individual. An individual in a hospital or care setting is more prone to develop this issue. They develop pressure ulcers when pressure, shear, or friction to the skin and the underlying soft tissues closes or damage local capillary, venous, or lymphatic networks. The cells around the closed vessels die, and if the pressure is not removed, the damage will spread. Damage may be caused by certain causes such as having low pressure for prolonged periods, for example, lying in bed for hours without moving; high pressure for relatively short periods of time, for example, rough handling when being moved or lying on the floor following a fall; pressure from equipment being used to monitor or treat an individual, for example, urinary catheter, oxygen tubing. The most common sites for pressure ulcers to develop are the head, shoulder, elbow, buttocks, and the heels. The severity of the damage can range from reddening of the skin to large cavity wounds with damage to muscles and even bones. A number of factors have been identified as being important in predicting who is most at risk of developing pressure ulcers. Some of them include age, health, level of consciousness, weight, nutritional status, mobility, urinary or bowel incontinence, and so on. In a healthcare setting, we use several risk assessment tools combined with clinical judgment to formulate the individual's care plan to prevent pressure ulcer formation and to treat or manage any already present. As a registered nurse, two important aspects of our job in preventing and managing pressure ulcers will be skin inspections and repositioning. Skin inspection is the best way of identifying whether pressure damage could become a problem. Ideally, the individual should inspect their own skin regularly for any changes, but this is not always possible, and you may have to carry out the inspection for them. This will involve checking the skin over bony prominences, for example, the heels, sacrum, buttocks, and any other areas likely to be affected by pressure. The signs of early pressure damage that you should look out for are non-blanching erythema, which is a redness of the skin which does not go white if you apply light finger pressure. The skin may also feel warm to the touch, show signs of edema, or become hard. Blisters. Blisters over a bony prominence indicate that the epidermis has become separated from the underlying dermis. Discoloration. In the early stages, the skin usually becomes red. However, watch out for other discoloration, which may indicate that significant damage has already occurred. If the skin appears more blue, purple, or black, it could mean that there is more extensive damage below the surface of the skin. Pressure ulcers are divided and grouped into four stages, which are: Stage 1, a reddened, painful area on the skin that does not turn white when pressed. This is a sign that a pressure ulcer may be forming. The skin may be warm or cool, firm or soft. Stage 2, the skin blisters or forms an open sore. The area around the sore may be red and irritated. Stage 3, the skin now develops an open, sunken hole called a crater. The tissue below the skin is damaged. You may be able to see body fat in the crater. Stage 4, the pressure ulcer has become so deep that there is a damage to the muscle and bone, and sometimes to tendons and joints. Repositioning is another important aspect of pressure area care, which is delivered aiming to relieve pressure from part of the body to another part. In addition to repositioning, there are various other techniques or equipments that's proven to relieve pressure for an individual, such as mattresses, pillows, heel protectors, and so on. There are two main areas of concern for health and safety when carrying out pressure area care. Infection control. It is very important to prevent any areas with pressure damage becoming infected. You can help to prevent the spread of infection by taking standard precautions at all times. Washing your hands is the most important method of preventing and controlling the spread of infection. Wash your hands thoroughly before and after carrying out pressure area care. Wearing disposable gloves and aprons. Wearing a new pair of gloves for each patient and washing your hands thoroughly after glove use and between individuals. Making sure the pressure area is covered with a dressing to minimize the risk of airborne cross infection, and so on. Moving and handling. Moving and handling injuries are unfortunately fairly common in any care setting. There is a risk both to the nurse or carer and the service user. To reduce the risk of moving and handling injuries when carrying out pressure area care, you should carefully follow the procedures specified by your workplace. These should include using correct techniques for moving and handling, checking your position and posture throughout the move, using hoists or other technical moving and handling aids wherever possible, encouraging individuals to move more by themselves, getting help if the individual is too heavy or the position is too awkward for one person to manage, using the lateral 30-degree tilt to reposition individuals lying in bed as this lowers the risk of back injury for the carer, taking particular care when moving vulnerable individuals across a bed or cushion to prevent abrasion of the skin due to friction between the skin and the mattress or cushion. Any abrasion can make superficial pressure ulcers worse, especially if the individual's skin is moist or wet due to sweating or incontinence. These are some of the knowledges that we should keep in mind when delivering pressure area care for patients under our care. As a new graduate nurse, it is important to know about pressure area care while you are working in any healthcare setting where individuals are deemed at risk of developing pressure areas. Hope everyone has found my presentation on pressure area care useful and enjoyed it. Thank you.